Welcome back to the TradNurse podcast. This is episode 34, and I'm so glad you are here. If you're listening to this, it is Lent. And if you're a nurse, you know that Lent hits different when you work in healthcare. The rest of the world gives up chocolate and swear words and maybe social media, but you've already been living inside suffering. You see it every single shift. You hold people's hands when their families can't be there. You watch people take their last breath. You carry things home that most people will never have to carry. And I want to talk to you today about what to do with all of that. Specifically, I want to invite you into a Lenten practice that has changed the way I approach adoration, the Stations of the Cross, and Lent specifically. And it's this: you do not go to adoration alone. You do not go to the Stations of the Cross alone. You do not go to Holy Mass alone. You bring your patients with you. Stay with me, because I think this is going to reframe the way you see both your work and your prayer life. The Stations of the Cross are something Catholics pray, especially during Lent. The 14 moments from Jesus carrying his cross to Calvary, to his death, to his burial. And I want you to think about your last shift. Think about the patient who fell again, the one you've helped up off the floor twice this week, who is too proud to ask for help, who is fighting his own body. That is a station. Think about the patient whose family stopped coming in, who looks at the door every morning, hoping maybe today. That's a station. Think about the patient who is dying and scared and asking you questions you can't answer. That's a station. Think about the moments you've fallen when you snapped at a coworker or a family member because you were running on 3 hours of sleep and your assignment was impossible, when you cried in the break room, when you questioned whether any of this is worth it. Those are stations too. Catholic nurses are not observers of the Passion. We are participants in it every single shift. The question isn't whether suffering is present in your work. It absolutely is. The question is, what are you doing about it? I want to gently challenge something. A lot of us, myself included, have treated adoration like a spiritual spa. We go there to rest, to get answers from Jesus, to have a quiet moment away from the noise. And that's not wrong. I wrote my whole book while sitting in adoration. It all came to me. And Jesus absolutely wants to give us a rest, to give you a rest. But I think we sometimes leave half of ourselves in the parking lot. And this is even at work. Do we want to be there? We walk in and we try to quiet our minds. We try to stop thinking about the patient we're worried about, the coworker situation that's been bothering us, the family member who looked at us like we had failed them. We try to set all of that aside and just be present. It's hard. I know I go to adoration because something is bothering me and I can't get it out of my mind. So I understand that impulse, that feeling, that chit-chatter in your mind. But what if Jesus actually wants you to bring all of that in with you? People brought the sick to Jesus in Scripture. They carried their friends on mats and lowered them through rooftops. They grabbed the hem of his garment in a crowd. They were not neat or quiet about it. They were desperate. And they brought their need and the needs of the people they loved directly to him. So adoration is that. It is you kneeling before the same Jesus who healed the sick and wept at the tomb of Lazarus and bringing him everyone you couldn't heal, everyone you couldn't fix, everyone you watched suffer this week. You are the intercessor. That is part of your vocation as a nurse, and as a Catholic nurse in particular. You're not just a healthcare provider. You're a mediator between your patients and God in a way that most people in that hospital never will be. Okay, so let's speak practically. How do you bring your patients to adoration, especially when you're exhausted and you can barely string two thoughts together. Here is what I do and what I want to invite you to try this Lent. Before I leave for adoration or Mass, or even on the drive there, I take 2 or 3 minutes to just remember. I think through my past week. I bring specific faces to mind, or people that are troubling me, or friends that have come to me with something that's bothering them. And this could be the patient in room 4, the family member that came to you crying, the colleague who I could tell was struggling. I don't do anything elaborate. I just remember them by name or by face. And then when I kneel down before the Blessed Sacrament, I say out loud in my heart, I'm not here alone, brought them with me. And then I just offer them. I don't have to have the right words. I don't have to know what they need or what God's plan is for them. I just hold them up like those friends lowering the mat through the roof. Lord, I can't fix this. I don't know how this ends, but here they are. I'm bringing them to you. This practice has done something in me over time. It has made my work feel less like a weight I carry alone and more like participation in something sacred. It has made me realize that my presence at a bedside is never just clinical. It is always spiritual. And it has made adoration feel less like an escape from my work and more like the place where my work is completed. So this Lent, I want to give you one simple invitation. Find 1 hour, even one 30-minute holy hour, to go to adoration, to go to Stations of the Cross, and bring your patients with you by name if you can, by face if that is all you have, you can't remember. You've been walking the nursing wards with them. Now walk them to the foot of the cross. This is your vocation. And that is the thing that makes Catholic nurses different from every other kind of nurse. Not just the skill, not just the compassion, but the intercession, the willingness to stand in the gap between suffering and redemption and say, Lord, I brought them. I didn't know what else to do, so I brought them to you. If this episode spoke to you, share it with a Catholic nurse in your life. Leave a review if you're listening on YouTube, Spotify. It generally helps more nurses find this show. And if you want to go deeper on faith and nursing this Lent, head over to TradNurse.com. There's more for you there. I'm praying for you and for every patient you'll care for this week. God bless you. I'll see you next time.